I had been sick for a while. My parents didn't really know exactly what was going on. One night, my mom came into my bedroom just to check and see if I was okay, and I had sweated through my bed. My mother could see my skeleton through the back of my body. I was laying on my chest. So she decided that night to rush me to the hospital, and that's when we were told that I had type 1 diabetes. As I got older, my care for the diabetes, it got worse. My first amputation was in 2001. I was scared. Like, I'm pretty sure most diabetics going into something like that the first time, I did not think that that would ever happen to me.
I came here about 15 years ago and was struck immediately by the number of cases I saw and how young many of these patients were. Many resulted in having loss of their lower extremity, and it was something I hadn't seen before in my practice.
Diabetic foot ulcers have been something that has been a part of my life even before I became a doctor. I remember going down south every summer and my Aunt Addie losing all of her toes. She had what's called a transmetatarsal amputation. So that's kind of what drove my passion to work with trying to prevent the large number of amputations that we've been seeing, which disproportionately affects communities of color.
I've never been mad, and I've never, felt like, why is all of this happening to me? But at the same time, I just felt like I wish this would stop.
If you look at someone who has a lower extremity amputation, their 5-year mortality is 50%.
This is one of the unfortunate things is not only could you potentially lose out on working, being able to enjoy life, but there's also a high risk of death that comes along with this that I think that people are not aware of.
So the issue of diabetic foot ulcers is actually at a crisis. The number of amputations occurring globally has gone up. In some ways, it's a paradox. How is it that we have all this new technology, we have a great understanding of diabetic foot ulcer, yet we have increased number of amputations? And it has to do with access, communication among the various specialties, and that's something that we're interested in improving upon. About 2 years ago, Dr. Myers and I got together. She's an endocrinologist, I'm an infectious disease person, and we started to think about how we could lessen the number of amputations from diabetic foot ulcers. And the administrators here at Montefiore Einstein, they recognize the problem, and they're very interested in supporting some of our projects.
So when I first transferred to Montefiore Einstein, the care became better. Montefiore had a lot more diabetic clinics.
One of the things that we think about is the patient's relationship with the doctor, the health system, but also it's a policy thing. So it's just getting the awareness out to the masses, but also to the politicians, because they can enact some of the changes that we need.
I have been prevented from a lot of things because of my diabetes. What I would say to someone who is in this fight with diabetes, have your life. Do not allow anything to take that away from you.